Historically, TMD, temporomandibular joint disorder, was literally inappropriately given to the dentist as a problem to solve and treat, because the first article written, that to my knowledge, first article written, which describes symptoms of TMD, headache, earache, jaw pain, ear pain, was written by an ENT surgeon in St. Louis, Missouri in 1934, published in a journal in 1934 by a Dr. Kostin, Kosten, and that is why for the first 2 decades of the problem with this joint, the symptoms associated with this joint, the problem with this joint was called Kostin Syndrome. He wrote the first paper, and thereafter it was called Kostin Syndrome meaning associated symptoms in one particular problem. And the associated symptoms that he wrote about were primarily ear pain, jaw pain, pain extending into the head and the jaw, and even headache. Headache, earache, jaw pain, neck pain. Those are the 4 primary symptoms of Kostin syndrome, which then led to temporomandibular joint disorder, which inappropriately is called by almost everyone TMJ, the name of the joint. Appropriate name is temporomandibular joint disorder, singular, not plural, because the disorder is only one disorder. And that was my discovery, that chronic inflammation within the temporomandibular joint creates all the symptoms. The symptoms are not created by too much motion of the jaw, although that's called bruxism. Too much clenching or grinding can cause muscles to get tired for sure, but that does not cause all of the symptoms. The symptoms related to TMD, temporomandibular joint disorder, singular, created by chronic inflammation within the temporomandibular joint, are now known to be and agreed upon to be by everyone. The symptoms of TMD are frequent and/or recurring headache, earache, jaw pain, neck pain, tinnitus, ringing in the ears, subjective hearing loss, feeling of fullness in the ears, dizziness, vertigo, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of jaw locking. Those are accepted symptoms of TMD. Now, those are very disparate symptoms. And what confused everyone, the dentists, physicians, and the patients for decades,